Welcome to our Beyond 20 campaign, a celebration of One Joshua Group's 20 years of service excellence. This is a One Joshua Group production, providing access to information and experts to help improve quality of life and health outcomes.
Thank you for joining us in our celebration of our Beyond 20 campaign for the anniversary. And we are so excited to have with us Dr. Kathleen Kennedy. And Dr. Kennedy is Dean of the College of Pharmacy at the Xavier University of Louisiana. Dr. Kennedy, thank you for joining us.
Oh, thank you for inviting me to participate.
So we have to let you know that Dr. Kennedy and Xavier University of Louisiana's College of Pharmacy, the Center of Minority Health Disparities Research and Education, is one of our longest clients, our longest consistent client. And we are so grateful for the support of Dr. Kennedy and Xavier and their team. And again, just to thank her for all of the excellence that she brings to the programming that we're responsible for producing, and most of all, for the information that's put into the greater knowledge base. So again, Dr. Kennedy, thank you so very much for Xavier and for the College of Pharmacy and for those things that you contribute generally as Dr. Kennedy and Dean of the College of Pharmacy. Mm-hmm. So we had an interesting conversation recently, Dr. Kennedy, and we're going to pose that to you. There's some people were unclear about what pharmacists did, and they told us, well, they work in this pharmacy and that pharmacy, and that's what they did. So can you expand on the role of pharmacists so that people really understand what pharmacists do?
So pharmacists have the knowledge and the training, the skills to do so much as relates to healthcare. In particular, there's extensive training on community engagement, interacting with patients, monitoring drug therapy, counseling patients, pharmacology, all of the aspects of medication therapy management. And pharmacists train in an interdisciplinary way with physicians, nurses, other healthcare providers, so that they are really an integral part of the healthcare team. So as such, they can provide advice, they can make recommendations about drug therapy. Many times the physicians will turn to the pharmacist and ask, what do you think is the best medication for this patient? So pharmacists are, as I said, part of the healthcare team in the hospital setting, in ambulatory care settings. And we always tell our students there's a broad area as far as career opportunities in pharmacy. I was recently speaking about one of our graduates who just retired from the veterinary program at LSU. So a veterinary pharmacist. We have pharmacists who work in industry. When we think about drug development, some of those individuals are pharmacists who are working there. So, just a broad area, career opportunities, nuclear pharmacy, and of course, the community pharmacy practice, either in independent pharmacies or in chain pharmacies. So, there are just many ways that pharmacists can interact with other healthcare providers to be an expert as it relates to drug therapy.
And Dr. Kennedy, it's interesting that you mentioned that is all of those people who are pet owners, as many times as they go to their vet, they never think about the fact that a pharmacist is involved in their pet. So just thank you for bringing that again to the light of those people who are paying attention. Why do you think it's important that patients get to know their pharmacist?
Well, I think that, pharmacists many times are the last person who interacts with a patient before they actually start taking their medications. And we know that many times, and studies have shown that patients go to their physician or to their provider, nurse practitioner, PA, and they get instructions and then they leave unclear about what they're supposed to do. And so that pharmacist is the one who can clarify or interact with that patient to make sure that they understand how to take the medicine, and just be that the person who is going to ensure that they're doing the right thing to improve their health.
Yeah, it's critically important. You talked about the importance of the pharmacist in bridging their care between
Mhm.
whatever the discipline is for the physician. And, we've all encountered that. I was in the pharmacy the other day, and the doctor had written a prescription for the patient. She came to the pharmacy to get her prescription, and they
Mhm.
filled the prescription for it. So it was
Mhm.
interesting because the technician was giving her the prescription, and her comment was, well, I want to see the pharmacist because I need to know whether or not I need to take this medication. Now, not going to tell you the ending to that story, but it was very important. I will tell you that the patient walked away without the prescriptions. So that's an important part of knowing the pharmacist having a relationship with the patient. And the other part, you mentioned community pharmacists, and many of these pharmacists are in the communities where patients live, or particularly those people who
Right.
use the pharmacy. How important is the pharmacist and cultural care of patients and their needs?
Well, again, I think that the pharmacist can relate to the patient, especially if they are from that area in the environment. They're familiar with that community and what patients believe, and that some of their health beliefs often may influence whether or not they decide to take their medications. It's one thing for a physician to prescribe it for you to get it filled. But then if you don't take it, and if you're not
Hmm.
taking it as prescribed, that is a problem. So many times the pharmacist can relate to that individual person. One of the things that we train our students on is being able to communicate in a culturally sensitive way to patients, so that they feel like they're being heard, and that you are trying to help them improve their health. We want them to advocate for themselves so that they can, do better and have better health outcomes.
So we hear about innovations in healthcare generally. Can you share with us some of the innovations that are taking place in the pharmacy delivery of care for patients?
Well, I'm not sure. It depends on where you're practicing, whether it's innovative or not. But more and more of our graduates are going into practice where they are involved in say, an ambulatory care setting. Many times they can see patients themselves, so that, for example, if you have a chronic disease, hypertension, diabetes, there's really no reason that you must see a physician every time. The pharmacist can monitor your care, especially on a regular basis, under, of course, the supervision of a physician. So they're working in collaborative practice settings. So that's really where we're going with that, as well as pharmacists can help when we look at the need for more minorities, in particular in clinical trials. The pharmacist can be that voice to know that you have a chronic disease, and maybe there's some study that's taking place, and you might benefit from that, or others may benefit from it. So that would be where pharmacists come in.
Mhm.
In our case, community engagement, again, to make sure that we're working in a bidirectional way with the community, finding out what their needs are, and interacting with them so that they feel like they're partners with us, trying to impact their health outcomes. So
Mhm.
community engagement is an area that is really growing, and more of our pharmacy graduates, our students, are involved in the community, because that's really the place where you get to understand what the needs are of the patients, and you can help them make decisions that are going to improve their health. And I guess the last is health informatics. There's so much data that's available on how patients respond to different conditions. And so just to have that information and to be able to use that in helping to make decisions about care is another way. Digital health. We recently established a telehealth center here. And again, a telehealth center can be useful in a number of ways, but one of the things that we do is to contact patients, to talk to them about their medication, to do what we call therapeutic management discussions with the patients about how they're taking medicine. So again, if you have a chronic disease, that's someone who you can talk to about making sure that they are consistent with their care.
So I think you've probably read some of my notes, and we're going to come back to some of these questions. How does one become dean of a college of pharmacy? You've talked about training. So could we talk about the training of pharmacists and then the reputation that Xavier University has for training pharmacists and other professions within healthcare? So tell us about how you got to be dean. I'd like to hear about that.
Well, first of all, the pharmacy programs now are 6 years for the most part. There are some accelerated programs that you can finish in 5 years. But to have an academic position, most institutions require that you complete a postgraduate training program. We call it a residency. So the first year is a general practice. So it's just general clinical skills building. And then many people select to do a second postgraduate training year, which is more specific for a certain disease state that you want to be an expert in. So if it's cardiovascular disease or renal disease, et cetera. There are also fellowship programs. So once you get your degree, you can do a fellowship where, again, you might be working in industry, and those are usually 2 years. In my case, I completed my training at the University of California, San Francisco, and I did a residency. And then I came to Xavier as a clinical pharmacy faculty member, where I practiced for a number of years primarily at the VA Medical Center here in New Orleans. And then the opportunity came for us to start a clinical training program at Charity Hospital, which at the time was, I think, the third largest hospital in the country. We had over 1,000 beds. And Charity Hospital really, the patients were those from underserved communities, people who really could not afford to go to, the bigger private institutions. It was a state-run hospital, and there I had the opportunity to really begin a clinical pharmacy program. So I was the only one for a number of years providing services to all the physicians and nurses in there with educational sessions, working with patients, et cetera. As we built that program, then the director of pharmacy left and recommended me as the new director of that program. So I had the opportunity to get training in hospital administration, hospital pharmacy, and there were 90 employees that worked in that department. So during that time, I took some leadership courses because in your training in pharmacy, you get some basic hospital pharmacy administration, but nothing to the size of what Charity was. So I did some leadership training for hospital pharmacy management, and then I actually was recruited away to go to industry, and I worked in pharmaceutical industry as a medical science liaison for about 8 years. But I loved academia. And so when the opportunity was available for me to come back to Xavier, I came back as an associate dean and served in that capacity for a few years until I had an opportunity to apply when they did a national search for the dean's position. So that's what happened. In the dean's position, or actually before I became dean, I did some other training at Harvard. I did the Harvard Management Development Program, as well as the American Association of Colleges of Pharmacy has a fellowship program, again, for developing leaders in academia. And so I participated in both of those programs as well.
So you mentioned the University of San Francisco. Congratulations on your recent acknowledgement and honor there. You also talked about an area that many people are not familiar with, and that's in the hospital. Now, Dr. Kennedy, I don't know where people think they get their meds in the hospital. I guess they think they all just come from the nurse's station, but they do from the clinical pharmacist. So we appreciate those pharmacists in the hospital to make sure that we're getting the appropriate dosages and medications that we need. Now, also in the College of Pharmacy, you helped to establish, I think, a center that looked at minority health. Can you share something with us about that and what's happening in that center now?
So, when I came back to Xavier, we had an opportunity to really focus the research and think about the future of what we wanted to do here in the college as we'd established our mission, which really is supportive of the mission of the university to create a more just and humane society. And so we wanted to focus on the health disparities that really in pharmacy school wasn't necessarily talked about a lot, but it's something that I thought was important here. And so we looked at the research that was being done and talked about how we could develop future leaders doing research in eliminating health disparities. And so we were successful in submitting a grant that was funded to help us in all of those areas, with research training, education, et cetera. And so since then, it has actually, we have so much work that we're doing now, primarily in community engagement, because I think people realize how you're going to make a difference. If you don't engage the community, you're not going to change anything. We can look at all the research, and we, of course, in particular here, have a lot of individuals doing cancer research. So we can understand what causes it and, treatments. But if you don't move past the bench to the community, again, you're not going to make any real changes in health outcomes. And so we focused from the beginning on the chronic diseases that I mentioned before that we know we can impact, particularly diabetes. That was one of our biggest areas because of the numbers of people who have amputations, have renal failure, go blind, all of those things that are caused by not treating diabetes effectively early on, in particular in African American communities. We saw the disparities that exist. And so we have clinical faculty who were positioned in clinics, in the clinics in the poorest areas of our city, who would help to monitor those patients and to try to improve their outcomes, their A1Cs, to get them better control. So that's really where it started with us, with diabetes and hypertension, as well as those individuals who are doing the bench research in cancer. Then after Katrina, the city saw an increase in asthma because of all of the devastation here. And so we focused on pulmonary diseases, in particular in children in the city. But now, since then, we have been quite successful in getting funding to look at just a number of conditions. We were involved with the COVID vaccine hesitancy, as well as before that, the testing. And we continue to do work in a number of areas, even now beginning to work in the HIV epidemic area. So we're working in the chronic diseases that I mentioned before, with the COVID vaccine hesitancy, with HIV, and continue with cancer. So those are probably the main areas that we working in.
So Dr. Kathleen Kennedy, who is Dean of the College of Pharmacists at Xavier University of Louisiana, has given us a part of the journey, her journey, and including that of the College of Pharmacy at Xavier, and also the Center of Minority Health Disparities Research and Education at Xavier. Now, Dr. Kennedy, you mentioned your work in COVID hesitancy. Do you see immunizations and vaccinations, and we want to use both of those words, do you see there is a disparity in those, and how are pharmacists able to address those disparities?
So yes, of course, there is the fear. People are reluctant to receive the vaccines, and early on, because of all the research, the clinical research, where African Americans were not treated fairly. And so when they look at a new, drug or a new vaccine, they're thinking, well, who was in the study? How many African Americans were in the study? Is it safe? And all of those things. And so as a college, we worked very closely with the communities to educate them. We partnered with faith-based organizations and independent pharmacies to try to reach the people. There's still some concern in different communities as we talk about this new booster vaccine that's available, I guess, now. We have people who are not getting their vaccines. So many devastating stories about people who have died unnecessarily because they did not believe or did not get vaccinated. And so as pharmacists, with the federal government, the PrEP Act, we were able to take an active part in vaccinating individuals who come into the pharmacies. We've had clinics here on campus, or we may have a health fair where we go out and provide vaccinations for COVID, or flu vaccines, or flu. So we are involved in all of those types of areas, or we can be, if we partner with the other members of the healthcare community to make an impact.
So we're hearing more and more about pharmacy companies closing pharmacies in neighborhoods. How do you think minority neighborhoods and minority patients are going to be affected by these newly emerging pharmacy deserts?
Well, I mean, it's a problem if, we think about a pharmacy being on the corner of, they say it's within five miles of where you live. And if in those communities there's no pharmacy, then that creates a problem for just the overall health of those individuals who have to drive or to ride the bus or some way get to a pharmacy to get their medication. So yeah, that's a problem. I don't know nationally how different communities are impacted by that. But as you see the mergers, we saw Rite Aid merge with Walgreens and other pharmacies like that. It can be a problem. We don't see as many independent pharmacies as we used to see. And so that's another issue, another concern where, again, minorities, African Americans can own their own business to open their pharmacy. So it is something that we need to be aware of.
So you mentioned telehealth earlier. Do you believe that this is an opportunity to make up for, bridge some of the closing of those pharmacies? And how does that work? We know going to a physician how telehealth works. How does telehealth work in the pharmacy community?
So for us, one of the things that I think I mentioned before is that it's important for patients to take the medications that they have that have been prescribed and that they've picked up. So if you don't or you're not taking it, then you what we do in telehealth is to call patients who are on the list provided by insurance companies that have chronic diseases. And so the role of the pharmacist is to review their medication list and to encourage them, educate them about the importance of taking their medication. So for us, that's what we mean by telehealth, that you have someone who is actually interacting with individuals based on their chronic condition and the medicines that have been prescribed.
Um, what about the cost of medication? How are pharmacists and how can we better engage in access, which is a disparity? Utilization is one as well, but what do you recommend about addressing cost for medication?
That's really a tough one because there are not many solutions to the cost. Some companies have, coupons or other means of providing the resources, but that really is a very difficult one. And I know that the current administration is advocating for um, the drug companies to provide the same cost that they do for Medicare patients, because the government puts a limit on how much you can provide for the seniors, but not necessarily on the other individuals. And so, if there can be some negotiation where the cost is contained that way, that would be another aspect. When I was at Charity, we had a person who actually interacted with the pharmaceutical companies. If we had a patient who could not afford their medicine, then it was her responsibility to contact the company to see if they had any patient assistance programs. And many of them do. You just have to know how to navigate that system. And so many, independent pharmacies don't have the resource. They don't have a person to be dedicated to providing, finding out about patient assistance programs. So it really is a challenge. And I think it's going to probably take some legislation to decrease the cost of medicines.
So, Dr. Kennedy, I'm talking to middle school students. What do I need to do as a middle school student to become a pharmacist?
So, we have partnerships with schools. As a matter of fact, our first year students go out and interact with students in middle school to talk about nutrition. So that's an exposure to the profession. So they see, oh, okay, these pharmacy students or pharmacists can do things other than fill prescriptions. But as a student, you need to be dedicated to your studies to make sure that you're getting the best grades that you can. I would look at summer programs at institutions. If you are interested in science, there are programs at many schools. We have them here at Xavier that provide an exposure to pharmacy as a health career during the summer, and you could spend a month learning more about pharmacy as a profession. And then as you get up to, as again, high school, those opportunities are still there. one thing that you might want to do is to talk to someone who is a pharmacist. Um, if you told your local pharmacist that you were interested in their career, sit down and talk with them about what it's like. What did you have to do to get to where you are? So those are the things that I think as a young person, you could do to learn more about the career. So many people only know about the pharmacist who is in that store filling prescriptions. But as I said, think about, nuclear pharmacy. When you go in to have some kind of test done, they're injecting dye or some chemical to examine your body. There's a pharmacist who prepared that. So, there are just so many career opportunities that you could have. And I think exposing people to those career opportunities early would make them, their eyes open to, the possibilities.
So, what makes you love your job?
Well, I like seeing the students who are successful. I
Mhm.
mean, we have so many who are working all across the country in different areas, and to hear that someone is the director of their residency program now who came here. I got an email from someone who's applying to be the chair of their department at an institution and wanting a reference. And I have one of our graduates is the only licensed marijuana dispensary pharmacy. He has two here in the city. The New Orleans, the Pharmacy Museum that's in the French Quarter, is the first licensed pharmacy in the country. And just a couple of weeks ago, they had the opening of the African American Museum component, looking at all the African Americans um, who had pharmacies here in the city. They did not have the opportunity to work in other places, and so they started their own. So it really is exciting for me to see the success of the students. I like to go around and, of course, brag on the fact that they have really good jobs. They've done well, and I think that's the important thing, that we are producing the next generation of people who are sensitive to the fact that there are disparities and that they can make a difference by interacting with patients in the community. So that's why I'm still here.
So, we are approaching the 17th Xavier University of Louisiana's College of Pharmacy's Health Disparities Conference in April of 2024. Let me
Right.
repeat that. That's April 2024, 17th Health Disparities Conference. Why did you find it necessary to start this conference 17, 18 years ago? And what's happened over the last 17 years with this conference?
Well, again, I think the importance was the fact that there was not there was really not much training in pharmacy schools about disparities and the role that pharmacists can play in health disparities. The whole idea of this professional, interdisciplinary team is relatively new. All of the health profession schools now require some interaction, but at the time that was not the case. And so when I moved to Louisiana, to New Orleans, what we were doing in California, they thought they'd never heard of as pharmacists out there. And I remember when I first showed up at the VA, they were wondering, well, why is this person here? So they really did not have the experience of working as a partner with pharmacists. And so I thought that it was important to talk about how we could all work together to make an impact on improving health outcomes. And so that was the goal, to present to the individuals in this community the role that pharmacists can play in
Mhm.
making an impact. And so it started that way. but it was always open to, policymakers, physicians, nurses, etc. And so over the years, what we've seen is that so many people, and even young people, students who are still in school, are thinking about the impact that they can make as they present their posters, their abstracts about what they're doing in their community. So, it really has sort of triggered in their minds, what can I do and what can be done in our community? And I think that has been the important part of it. There's so many new things that we hear about each year. I can't even get around to see all of the posters and the abstracts of what people are doing. And what we said early on is that we want you to take what you learn here and go back and do something in your community. Don't just come and sit and listen, but think about what you can do to make a difference. And so that's why I think it's been very important. And that's why we sort of continue these conferences.
Well, this is Dr. Kathleen Kennedy. She's Dean of the College of Pharmacists at Xavier University of Louisiana. She's not only Dean, but she's an accomplished vocalist as well. So I want to make sure that we put that in there. Now, Dr. Kennedy, what would your last thoughts be for our viewers to be sure that they remember from this podcast from Kathleen Kennedy?
Well, I guess since we're talking about the pharmacist role, that, to make an impact on moving toward health equity, it takes everyone. Involvement of all the members of the healthcare team, that I hope that everyone remembers that pharmacists can play an important role in that. And if we all work together, I think that we can make a difference.
Well, Dr. Kennedy, thank you very much. It's always our pleasure. You've been listening and watching Dr. Kathleen Kennedy. She's a vocalist and Dean of the College of Pharmacy at Xavier University of Louisiana. Dr. Kennedy, again, thank you so very much for joining us. And of course, we'll be seeing you. For each of you who are viewing our podcast, remember, this is an opportunity to learn how people contribute to social justice, to improving health outcomes, but most of all, to improving the quality of life. Dr. Kennedy has given us a lot of information for us to think about, some information that's new for us, and other opportunities where we can share with younger people about very interesting, lucrative, and important professions. Again, thank you very much, Dr. Kennedy, and we'll get to see you again. And thank you for joining us, and look forward to our future podcast.
This edition of Beyond 20 is a Life Beat podcast sponsored by One Joshua Group, your strategic source of engagement to improve life through better health, education, and information. For more information, visit us at theonejoshuagroup.com or follow our work on LinkedIn, Facebook, Instagram, and Twitter using hashtag OneJGCollabs. One Joshua Group, building capacity, expanding resources, joining what you know with what we've learned.